Hi all, good morning. My name is Denise from the marketing team at CCD Health. We appreciate you joining us today for this leadership talk session, Successful Outsourced Scheduling Experience in Healthcare Centers, Key Lessons and Best Practices. Today we have the pleasure to have two special guests from the healthcare and patient access industry. It's my pleasure to introduce to you Grace Hildwein. Grace is an accomplished professional in the hospital and healthcare sector, boasting a wealth of experience in management and business analysis. With a bachelor's degree in business from Florida Atlantic University, she has honed her skills in project management, operations, management, and effective communication. Additionally, she is recognized as a technology-driven solution expert, leveraging innovative approaches to enhance healthcare services. Grace currently serves as the Special Projects and Integrations Director at RAYUS Radiology, a respected radiology firm in the US, offering a vast range of expertise and with super specialized radiologists and comprehensive services. Welcome, Grace, and thank you for being with us today.
Thank you.
Our second guest today is Kalil Diaz. Kalil is a Yale School of Management and Concordia University graduate. Before joining CCD Health over 10 years ago, where he serves as CEO, Kalil was a managing partner at Emergent Capital and a lending manager at GE Capital. CCD Health specializes in patient access, and it is the premier appointment scheduling service provider for healthcare centers in the United States, mainly helping healthcare and radiology centers overcome challenges such as staffing level challenges, patient experience improvement, and operational cost optimization. Welcome, Kalil, and thank you both for making the time to be here with us today. Without further ado, let's dive into the topic for today, which is successful outsourced scheduling practices experiences. Scheduling is sometimes overlooked as a not so relevant operational function, but when it is optimized, it can become a growth lever for healthcare practices as it directly impacts patient experience, quality of care, revenue, and even reputation for healthcare centers. The result will happier patients, reduce no-shows, optimize provider time, and increase capacity. Um, Khalil and Grace, with that initial thought, I'll hand it over to you to start the discussion.
Thanks, Dennis. And I'll walk through some thoughts before I jump into some of the questions that we have today. I speak from our experience at CCD Health and what we've learned over the past 10 years in scheduling appointments, where we do over 4 million appointments per year. We do this across the nation, across, call it more local practices, more regional practices in the multi-state, and several national practices. And what we've learned is that scheduling is important and patient access is important to many of our partners. And not only getting by and just getting it done well is not it's not sufficient to really take your practice to the next level. It's how do you really augment and see this as a value driver, not on the cost side from a savings side, but from the revenue side, and most importantly, the patient satisfaction on their journey to get the care that they need. And what we've seen is that many of these patients who have a positive experience from A to Z are the ones who will be keep coming back for other needs. And our goal is to enhance that and what we do. And we've seen a lot of positive results when we do it right, which means efficient, right? People want to get scheduled as fast as possible, be seamless, meaning have something that's available, ideally very short window, because that's if they're getting cares because they're either in pain or in need of seeking answers. So we help them get the best slot possible in the best location possible, which most of the times they're multi-location practices, And giving that convenience to the patient will obviously have a high satisfaction and also improve the ability that they actually show up to the appointment and get the care that they need. If they are confused, they're not going to show up and they don't convert as appointments. We also know about the no-show problems as well. And before I get started with questions, we've seen the inverse be very painful, which is, if we're not properly staffed, you have the abandoned calls. The abandoned calls really are troublesome because not only do you miss out on that person's care and potential outcome, but also on the revenue assigned to the fixed cost of your practice. So for us, seeing those practices that have high abandoned calls really has low patient satisfaction, but also even worse, we've seen that, close to a third of patients never call back. So meaning that they either don't get the care or they go to another competing practice, especially in the private side. So for us, we see that as a key importance is to be able to answer the calls in a timely manner. But also, the second part of it is also the errors, right? Making sure that we have a high compliance score, and then we always seeking ways to reduce errors. Errors will happen, but we want to keep those to a minimum so that we don't have the inconvenience of them having to reschedule or rebook under missed exam. So that's a bit of the prelude, and thank you so much, Grace, for joining us today. So we just want to have a conversation here, very casual, just to learn a bit more about the experience. For many practices, outsourcing feels like it's very difficult, or it's very much obviously not possible. But the reality is that we've seen many partners for many years see value, right? There's obviously pros and cons to being insourced, but we do also see value in having a third party, compare and contrast results and help offset any misses in the potential staffing needs or abandoned calls. So with that, I have a few questions that we'd love to walk through. The first is before you outsource, right? And just kind of walk us through, your historical experience. Is what were the financial implications or challenges that your practice faced before outsourcing, before you considered, what are some of the day-to-day things that actually prompted you to explore this as an avenue in your industry and your space?
I think to start is, when you're a smaller practice or you have a small scheduling department, um, being able to, expand on your services and the ability to take more calls is going to be difficult when you're trying to hire, right? Sometimes the hiring pools are not that big in the area. At that time, we weren't doing remote work that, is now a part of our regular lives. So trying to find staff and schedulers that you can hire quickly enough to be able to keep up with the demand of the calls that were coming in. So I think that that's really was a huge driver. And also the expertise that we didn't have, right? We were a small scheduling department. There was not a lot of things like KPIs and reports and tracking truly what the performance was. And that probably was as well another driver to say, okay, we want someone to come in that is an expert to help us maximize our productivity and our efficiency, and to help us be able to scale faster to accommodate that volume that we have for patients and then not take a long time. And along with that as well with staffing, we all know that a full-time employee is going to cost a lot more from a benefit standpoint, all of these other things. And if you are performing well, and it's also a lot harder to keep up with the turnaround, right? So I think there's different challenges, but those are the main ones.
Thank you, Grace. And with regards to these challenges that you highlight, how do you believe those challenges impact the specific kind of patient care and satisfaction, right? Obviously, can you talk a bit about how you've seen some of these challenges kind of spill over to the patient satisfaction side and how it's closely related? If you can just help explain a bit about how do you see them all connected?
Of course. I mean, the main thing was being able to keep up with the volume. Abandonment rates were higher. We weren't able to get the patients in fast enough. They would get tired of calling and just call someone else. So that really was the main driver from the patient satisfaction standpoint, is giving that point of access to the patient, that with the limited number of schedules that we've had and not being able to quickly enough scale our staff to accommodate the growth that we were experiencing at the time.
Of course. Thanks for that. And if you can, kind of very similarly, as you talked about some of the data services and the KPIs, can you talk a bit about some of the newer KPIs that you've started to look at, call it going back to those kind of partnership to now the new KPIs? What are some of the KPIs that you track to kind of drive or that you've learned to track now in your operation to both host your partners accountable for performance, but also making sure that we're trending under the right curve for continuous improvement? What are some of the things that you monitor from a KPI standpoint?
Of course. So I think we always monitored the basic things like how many calls we were taking, how many calls we were abandoning. But it was very, superficial. I think now we're digging more into the details of agents, right? Like truly, how long are their calls taking? Are they putting patients on hold? How many appointments are they scheduling? What is our conversion rate? How much utilization? The time that they're actually on the phones, are they being productive? So I mean, it's all these things that come together that tell us the true performance of the department as a whole and the individual. So I think it's a two-pronged approach: is individual KPIs that we're looking a little bit deeper, that we've been able to help identify who are our low performers, who are our high performers. I think before you would say, okay, this patient took 100 calls, they're great. But when you start to really dig into their calls, their quality is not that great, as opposed to somebody who's taking 40 calls and they have 0 mistakes, and their call time is longer. So it's finding that balance somewhere in the middle of using the data to help evaluate and see the bigger picture. And it doesn't make it as manual. So the data really drives our decisions because it's, very standardized across the board, and you can compare each agent equally as opposed to it being subjective.
I agree, and thanks for that walkthrough, right? Because going to the individual specialist level is, from what we've seen, a key strategy to improving your patient access. Because ultimately, you'll be able to understand which specialists need more coaching, and which might not be the right job or the right fit for them, and we have to find someone new. So can you talk a bit about, with regards to some of these, either in-house or even with your third party, how does working with, over time with this new performance view has improved, right? And talking a bit about the low performers and what cycles have you been able to learn on holding your partner accountable for those low performers, and maybe talking a bit about what quality measures have you learned to do to ensure beyond of the coaching to get and improve each individual? Can you talk a bit about those individual strategies once you know that there's a bottom pool of performer and you have the stack rank? How have you been able to do it in-house, but also through us, ensuring that we do it correctly? Can you talk a bit about that process? Because I know it's part of the key formula for success.
Yeah. And I think before we partnered with you guys, there really was no quality review, right? There was nothing that was telling us how the agent was doing. Yes, calls were being listened to every once in a while, but again, it's so hard to do that when you're one person, a manager or supervisor managing 30 or so agents. But definitely having that kind of support and service from you guys with the quality portion, it's what really helps us to manage and do that more efficiently, right? We're still only 1 or 2 managers or leaders on our side, but all the work that we see with the metrics and the measures that we put in place of what needs to be met every single call is what's going to help us drive that. So the calls, the checkpoints, all of that is what keeps us going and keeps track of that outside of just the numbers, right? Because the numbers are going to be one thing, the data is one thing, but the quality, listening to the calls, seeing what the tone of the agent is. Did you, try to help the patient? Did you dismiss them? All those little things really help to drive it a little bit more, because you can be efficient with your calls, but if the patient on the other side doesn't seem that you're empathetic or that you're trying to help them and you're just very robotic with them, I don't care how many calls you take well. Like, that's a huge part of it as well. So I think that the numbers help in one way, but the quality portion of it helps us with our customer service and improving that patient experience, so that we're not just focusing on the number of calls, the number of appointments that are scheduled.
And that's very well said. And I think, one of the key takeaways is you have to find the optimal balance, right? It's ensuring really good quality scores or low errors while still being efficient enough on your kind of calls or appointments per hour or the amount of time you take on the phone, because it's a lot of moving parts. And I think part of what the continuous work is to become better and making sure the quality is not negotiated, meaning we have a high expectation for each individual. And I think this is where it's important that each individual has to be measured, and then building that quality to have low errors. And whenever they do have errors, we have closely monitoring to make sure they improve or we find the right people to replace them. With regards to, linking some of your practice revenue to the ability to staff correctly, can you talk a bit about some of the revenue gains that you get when you're able to answer most, if not all, your calls? Um, you cited some of the challenges in recruiting and staffing, being part of the reasons why it's hard to keep up with the needs. But with a partnering approach, what you have is an additional set of staff that you can complement your existing team. Can you talk a bit about how have you seen the ability to answer the calls for the appointments have a correlation with your revenue? Obviously, not with specifics, but just kind of at a high mark, just talk a bit about that correlation that you've seen.
I mean, definitely the biggest impact that it has had is the ability to scale. When there's been times where we've had huge influxes of volume come in, that's something that we would have never been able to keep up with. And even when we've experienced that with having you guys as partners, you have the ability to scale up quickly in order for us to keep up with those calls. So that alone helps us capture those patients and those abandoned calls. The abandoned rate reduce a lot in order to keep going, because as you know, once a patient, can't get a hold of you, they're going to go to the next person. So I think we grew very fast. You guys were able to grow with us, so that in turn helped to keep up with our revenue and not losing the opportunity, and not having empty centers, right? Because as we grew their centers, it's getting them filled. It's getting them on the patients on the schedule as quickly as possible in order to keep up with that expansion that we had. So I think that's where was the biggest help on our side, was being able to scale up quickly when we had huge growth all of a sudden overnight, and not losing that huge potential for patients to be on the schedule.
Great, and I appreciate that, and I think some of the challenges is all these moving parts. You have to have the right quality, the right staffing, the right productivity, but then at some point you might have these shifts in volume, most of the time for the better, whether it's seasonality around breast cancer awareness month, whether it's other spikes in volume, just for the new site openings, and being able to be flexible up or down. I think it's key to be able to navigate that. And I think for us, we see the value also in forecasting that and kind of be as nimble as possible, I think is the key. And you've done a great job as well as a partner to improve and have an enhanced patient experience.
Mm-hmm.
So I do have one final question, then we'll go to some parting thoughts. What are some of the key recommendations that you would offer to other healthcare leaders who may be joining this webinar with, just seeking for help, right? Just they're probably going through some challenges, whether it's staffing or just patient quality or satisfaction. What are some of the key recommendations that you would offer to other healthcare leaders who may be exploring whether to outsource to a partner, just based on your experience, just any recommendations on the right steps in the process?
I think the main one is don't try to fit your outsourced partner into your box, right? You may do things a certain way in your center, in your office, in your company, but really leverage the expertise of the partner to help you improve your process. So start off slow. Don't try to give everything all at once. It's better to phase things out and slowly build a foundation you can build a house upon, than to try to throw everything at the partner. And that I speak that from experience, from not only with here, but with other companies that I work on. When you try to put too much into it and you try to fit, someone from the outside into this box of how you do things, it's not going to work, right? You don't have the same people, the same knowledge. leverage the expertise of your partner. And that's really what's going to help you be the successful, have that successful partnership. And I feel that that's what has made us the successful partners, because we slowly started out. What you guys do for us now is not what you did. Now, God, it's 4 years ago now, more than 4 years ago. When we started, right? It was slowly getting there and building that confidence and that trust between the two of us in order to get where we are now. So that would probably be my biggest recommendation for anybody who's looking to outsource or partner with anybody on in this kind of world.
Thank you so much, Grace. I know, Dennis, we have some parting thoughts. You would like me to start?
Sure, Kalil.
Great. So for the audience here today, what I do want to encourage you is to, seek ways to improve your patient access. It will impact positively your revenue, but also patient satisfaction. There are partners that can help you. One of them is us, CCD Health, where we specialize in scheduling and other patient access functions for different healthcare groups across the country. We've done it over 10 years with over 1,000 plus patient care specialists. And the ability for us to impact that, we've seen many practices that might be cautious around outsourcing find a lot of success over multiple years. We often encourage to start small and not replace, but enhance. It could be 5 FTEs or 10 FTEs and do it under a short-term period, right? Ultimately, it's always up to you to determine whether or not to continue. And it's that try before you buy approach. So for us, we've seen great success with many partners over the years. And we would encourage you, if you're facing challenges on conversion rate, on abandoned calls, on just finding ways to, enhance through KPIs, which ultimately brings a good sense of accountability. Having a second party would also create good energy internally to make sure that we keep up to the highest standards. So for us, we would highly encourage, even on a trial basis and a small sample size, to do a pilot, because that often will lead to the best decisions if you decide to continue. What we've seen is an ability not only to reduce costs from a unit versus called in-house operations, but also to enhance revenue through cross-selling opportunities, through innovative technologies. We've developed several different platforms that are now proprietary to enhance the experience and reduce errors. So we're obviously seeking new ways to enhance, and that's our quest. So again, thank you so much for your time today. We're eager to learn more. We have our contact information here within this webinar. And if you have anything, we're happy to help, even on a complimentary basis, explore what your call requirements and different things on the nature. So thanks again. And I'll let Grace have any final parting thoughts. But again, it's been a pleasure, Grace. And thank you so much for your time and thoughts today. I know it's been valuable to many other leaders who may be facing, very challenges that you might have been facing 4 years ago. So I appreciate being so candid in sharing. So thanks, Grace.
And definitely, I enjoy working with the teams. Everybody at CCD is wonderful. They're knowledgeable. They're willing to do anything to be true partners and have teamwork. So I appreciate that. If you ever get a chance to visit their operations, beautiful, very state of the art. I was jealous of how amazing the center was in Santo Domingo, and I'm looking forward to maybe visiting the Santiago one this summer. So for sure, definitely recommend partnering with CCD.
Thank you so much, Grace.
Thank you both. That was super insightful. I believe that you have provided a lot to think about for healthcare and radiology leaders to consider when looking to outsource their non-medical functions and enabling them to center on what matters most, which is patient care, right? So to our audience, we hope this exchange of ideas serves as a starting point for optimizing your practice processes. Please remember, in healthcare, exceptional patient support is not just a service, it's a strategic advantage. To learn more about the optimized scheduling services CCD Health offers to radiology and healthcare centers, visit ccdcare.com. Subscribe to the newsletter. Special thanks to Grace and RAYUS Radiology for providing this platform to foster collaboration within the healthcare community in the U.S. To you all, thank you and have a great rest of your day. Thank you.